Dr. Robert Strang. I'm the Chief Medical Officer of Health.
And I'm Dr. Gaynor Watson-Creed. I'm the Deputy Chief Medical Officer of Health.
So what was just announced was a directive. So any public sector employees, people in the healthcare sector, our public school system, and people within government, that we're being directing anybody in those sectors who travels outside of Canada now has to, on their return, self-isolate for 14 days, 14 days starting when they return back to Nova Scotia. And that self-isolation really means staying at home, don't go to work, don't go to school, avoid large crowds, don't go shopping, all those kind of pieces.
Although we've made those decisions for public sector workers and public sector employees, the reality is that what we know about the coronavirus is that it is efficiently spread in any group of people. And so although it has come as a directive for the public sector, our hope is that people in the private sector and private citizens will take similar measures, knowing that this is an efficient way potentially to reduce the impact of the virus in Nova Scotia.
So along with this travel-related piece, and we may, this virus is rapidly evolving, and in terms of its spread, we're seeing now more spread in other parts of the country. We may evolve this over time to deal with travel even within Canada. This is an evolving situation, and our response will evolve as necessary. So along with the travel restrictions, we're also continuing to emphasize public health measures around personal protective measures, as well as what we call social distancing. And I'll let Dr. Watson-Creed explain those a bit more.
So one of the things that we talk about when we talk about social distancing is this notion of maintaining as much separation as you can between one individual and another. And folks will hear about 1 meter or 2 meters as being that rule. In addition to that, as we've talked about already, avoiding large crowds is really key to preventing the virus from having the opportunity to move from one person to another. Those things will be helpful as the coronavirus epidemic continues, but the basic measures that we don't want people to forget about are also in play. Respiratory etiquette, the idea of covering your cough or your sneeze, even with the elbow of your sleeve, if that's all that you have, will be really important. And although everybody has been worried about catching this virus through the air, the reality is that the biggest threat to any of us in terms of contracting this virus will be from our own hands. And so hand washing becomes a critical point in terms of combating the spread of the virus. So for Nova Scotians who have concerns that they may have been exposed to coronavirus while they were traveling, or if they have symptoms of coronavirus, which would include fever or cough, we are directing them to 811 as their first stop. That will give them the opportunity to be assessed by 811 to determine whether or not they need to go into an assessment centre. We are asking Nova Scotians to pay attention to this message and to please reserve 811 for those who need it, either for coronavirus-related health concerns or other health concerns that are appropriately managed by 811. Specifically for coronavirus, we are also asking Nova Scotians to not randomly present to emergency rooms or the assessment centres with their questions or concerns, but to go through 811 first, because 811 will be able to direct you appropriately to the nearest assessment centre that will be able to manage your symptoms. In addition to the call to 811, Nova Scotians are invited to visit the 811 website, where they can get access to an online assessment tool that may help them work through the symptoms that they have and determine for themselves whether or not a call to 811 is in fact necessary. Other information on coronavirus can be found at the Nova Scotia Government webpage for coronavirus, which is novascotia.ca/coronavirus. That also has important links to the federal government website on coronavirus as well.